Hi, this is Josh. I'm a pharmacist with pharmacisttips.com. Here to talk a little bit about switching from Valsartan, or the brand name in the US Diovan, to Olmesartan, or the brand name in the US Benicar. First, why are we seeing an increase in switching is there was a recall. They found one of the products, it's part of the production process of the raw ingredient for Valsartan. And actually, all of these in this class, this can occur. It's usually washed out, cleaned out before the product is used to make tablets. So they found some of this, and this ingredient can increase the risk of cancer. It was very low. It was just exceeded the acceptable levels of this compound. It, it it can increase the risk of cancer, but it was very small. It was so much that people could finish out the Valsartan that they already had. So it seemed like the levels of the compound in the Valsartan tablets would have to be taken for years, and even at that rate, very few people would, like 1 in 8,000, I believe is what the number was, would develop cancer because of it. So many people are switching from Valsartan to medications like Olmesartan. Now keep in mind, Valsartan is still available in a short supply in the US from the manufacturers that were not affected by the recall. So some patients, we've been able to just keep them on Valsartan. Many people have switched. But that is, of course, something you need to talk to your doctor about. Both Valsartan and Olmesartan are ARBs, or angiotensin receptor blockers. All you need to know in the body that basically causes the blood vessels to relax. That relaxation brings blood pressure down, reduces your risk of heart attack and stroke, and improve things like congestive heart failure. The Olmesartan, or the generic for Benicar, is available in a 5, 20, and 40 milligram tablet, or in a combination with hydrochlorothiazide, which is a water pill. We have the 20 12.5, the 40 12.5, and the 40 25. Now, Valsartan is produced in a 40, 80, 160, and 320. It does have more options in the combo: 80 12.5, 160 12.5, 160 25, and then the 320 also comes in 12.5 and 25 of the hydrochlorothiazide. So approximate conversion, if you're on 40 of Valsartan, that puts you in the 10 milligram neighborhood of Olmesartan, 80 of Valsartan, 20, 160. There's some, this is not an exact conversion, so this is going to depend if you're running a little high or if you're running a little low. This can help your provider determine whether you're suited for the 20 or 40 milligram dose. 320 usually, if your doctor decides to switch from Valsartan to Olmesartan, it would probably be 40 milligrams. So even though these sound like a big difference, they're approximately equivalent as far as the effect on blood pressure, the control that they have. So the combos with hydrochlorothiazide, you maybe remember from the couple slides ago, there are less options with the Olmesartan. And so you may simply need to take the hydrochlorothiazide separately, as the Olmesartan has fewer options. So anytime you're switching blood pressure medication, you're going to want to monitor your blood pressure. You're going to watch, just want to be mindful if you feel faint or dizzy, lightheaded, all indications that maybe it's working too well, or you monitor to make sure it is adequately controlling your blood pressure. Then your doctor will probably want to do labs measuring potassium and kidney function, maybe even liver function, depending on your risk factors. Anytime you switch, after a while, we just need to have you go in and check, make sure everything is as it should be. All right, I appreciate you watching. I hope you found this information useful. I would love it if you'd subscribe to my channel if you found this information useful. And remember, always speak to your healthcare provider if you have any questions, if you feel like you're having side effects, any problems with your medications. Thanks for watching.